and welcome everyone. This is I Strive to Thrive, broadcast right here only on Get Vocal. It's where people are connecting in social media environments and video chats. It's just so awesome. And I'm just so amazed that we are able to do what we're able to do today. And this is going to be a really fun day for a lot of people. Hey, if we haven't met, my name is Joe Burke, and I'm an advocate and a public speaker here in Central Florida for the Hemophilia Foundation of Greater Florida and beyond. I help people with bleeding disorders, and I kind of advocate for them. And I do a lot of things on the side as well for the bleeding disorders community. And, if there's one thing I wanted you guys to be empowered about today, and that's walking boldly in the mindset that you are not defined by your illness. Now, this is just a quick disclaimer. I am recording today. So when we open up the seats a little bit later, you will be on a recording. So keep that in mind. And also, I will be doing a live intravenous infusion. Well, what does that mean, Joe? I'm going to be sticking a needle in my arm in a vein, and it's going to be live here on camera, but it is a part of my daily routine. I have to do this 2 to 3 times a week. Okay. So if needles and blood aren't your thing, you might want to just look away for just a second while I do that. But, just a brief rundown. I'm going to be sharing my story, and I'm going to be giving a detailed account of many of the multiple chronic illnesses that I live with. And it's hopefully going to educate you guys, and you guys are going to be inspired. And I hope you guys are just going to take what's said here today and just take it along with you and know that there's a lot of hope. Despite a lot of circumstances, there's a lot of hope that comes out of it, okay? But remember, you are not defined by your illness. So I want to make sure to reiterate that as much as well. So I want to take a few moments here and just want to thank a couple of people that's really made this come together, especially the Get Vocal team right now for joining me here in the room and just coming around not only me, but my story and seeing something that's greater, seeing something that's amazing, and knowing that there's a potential there to be able to share that with a lot of people. And I just really want to thank Gisela and all the Alexanders over at the Get Vocal team up in Boulder, Colorado. Hey, love you guys. Thank you guys so much for doing this and helping me put this out there and promoting it. Man, I couldn't do this without you guys. And again, and Anton as well. I can't forget Anton. But I'm going to go ahead and dive right on into you are not defined by your illness. That is correct, JS. JS Gilbert is actually talking to me in the chat room. Seeing this over on YouTube right now or on Facebook live. If you come over to getvocal.com, that's getvokl.com, you can create an account and you can join me live right here in the chat room, and you can ask questions and partake as we're going through this live, okay? So let's talk a little bit about the subject, why we're here today. And so hemophilia, what is it? Hemophilia is a blood clotting disorder. And I have a couple of little fancy schmancy graphics here that I'm going to use. So I'm going to go ahead and roll those graphics on over here. And it's kind of going to help us kind of paint a picture of really what's going on. And so this is a visual graphic representation. It shows the male and the female, the father and the mother. As you notice over on the mother's side, the father has XY and the mother has XX. And one of the X chromosomes in the female side actually has a mild, and it is that mutation that is passed down from mother to child. Now, if you look down, there's possible scenarios at the bottom on how hemophilia, the inheritance pattern, how it takes place. The father now he has both the X and the Y chromosomes, and the father is, if he's a hemophiliac, which is the one highlighted in green, he's going to pass that on to his daughter, but he's not going to pass it on to his son. Now, over on the female side, the female has her XX chromosomes, but if she has also the genetically modified X chromosome, the one that carries down the hemophiliac gene, then she is going to pass that on to her child. And that means that her child, it's a 50-50 chance it's going to happen, that it's going to be daughters will be a carrier of the hemophiliac gene, just letting you know that. But there's a 50-50 chance that the son will be a hemophiliac or not be a hemophiliac. So it's interesting how the hierarchy and just everything pans out in terms of the bleeding disorders. And so as we look at that graphic, just for a quick second, you can kind of see how the hereditary aspect of hemophilia comes down from parent to child, and it continues on like it has for centuries. And so there's 2 different types of hemophilia. There's hemophilia A, there's hemophilia B. There's also von Willebrand's disease, which is another form of bleeding disorder. It's most prevalent in females, but guys do get von Willebrand's disease as well. And there's two different kinds of factor concentrates that are involved in hemophilia. Now, let me explain what in the world is a factor concentrate, Joe. Whoa, stop. You're going too fast. All right. Your blood has several factor proteins in it at all times. All of those proteins, when you get cut or injured, they race to that one spot and location to start forming a clot. All right, so you have factor 8, factor 7, factor 9, factor 12, factor 10. You have all these factor proteins, and they come together and they start that adhesive process of forming a clot. Okay, are you with me? All right, so the one thing that holds all of those factor proteins together is one called factor 8. It is literally the Elmer's glue that binds everything together. So when factor 8 is not prevalent in the bloodstream, what's going to happen to all the other proteins? They're just going to scatter, right? So when you don't have factor 8 in your blood, like yours truly, that means you can't clot. That means you got some problems. That means it's, you got to watch what you're doing. So it's really interesting when you think about it. And there's also factor 9 too, hemophiliacs, and that's even more, a little bit more complicated. But it's not like the best analogy I give a lot of times, it's not like a water hose is turned right on and you're just like gushing, like some kind of crazy movie scene or something. No, it's not that. It's actually, that just basically means you have to hold pressure longer for the clot to actually start to form. So if you get cut, what do you hold your hand for like 2 or 3 minutes and you're good to go with the rest of your day. For a hemophiliac, that can be like 15 or 20 minutes or longer, depending. So that's the best analogy that I can give. Now, I do have some pretty cool x-rays to show, and I want to explain how hemophilia affects you physically as well. There are a lot of physical ramifications coming in from hemophilia. The first one is my elbow. I have an elbow x-ray here, and it's kind of interesting. Oh boy, here we go. So this is my elbow. This is it's crazy. So the top one is what a normal elbow looks like. You can see that there's normal spacing between the joint, the radius, and the ulna. You've got good motion range. Then you get down to mine. Well, it's not exactly perfect. So let me explain this process here. This process is really interesting. In a hemophiliac, and let me get rid of the graphic so I can explain. In a hemophiliac, when we overexert ourselves, for example, say I go outside and I mow the grass. Okay, probably not the smartest thing to do as a hemophiliac, but I do it a lot anyway. But say we go outside and mow the grass, and my knee starts hurting, and it begins to swell up and get really hot to the touch. For you, like for a normal person, if you go outside and you do some kind of physical activity and you get like an elbow pain or a shoulder pain because you've kind of worked out and you're sore, you wake up the next morning, you're fine because your body has all the factor proteins it needs. In a hemophiliac, let me explain the process again and pull up the graphic. In your joints, to move fluidly, you have a sac of called synovial fluid. In all of your joints, there is a membrane called synovial fluid that allows your joints to move and function properly. Okay. In around that sac called synovial fluid is thousands of capillaries. All right. Do you see where I'm going with this? When you overexert yourself as a hemophiliac, those capillaries in the joint literally rupture and cause your joint to bleed internally. So blood is literally flowing and filling into the joint, causing a lot of pain, a lot of trauma, and a lot of damage. All right, so let's look at the right ankle x-ray. And I'm going to be explaining all of this in detail. So don't think that I'm going to leave you hanging, okay? So this is my my right ankle, all right? Again, we're looking at this together. So left ankle lateral x-ray, that's a normal. The top is normal. You can see that there's good spacing between all the metatarsals and all of that. And you get down here to the bottom of my x-ray, you can see that the spacing is closed up. The joints and bones are almost literally fused. And we have arthritic mutations already at the joint because that is what's called a target joint. That means that joint will bleed and it's very active. Like I have to watch a lot of things. I can't do a lot of inclines. I can't do a lot of steps again, as a hemophiliac, there's a lot of precautions that I have to take. And last X-ray is kind of the cream of the crop, if you will. This is my right knee. All right, so the right image that you're looking at is a normal knee. That's actually my left leg. And then you get over to the right side, the left side of the screen, and you notice how the bone has grown 30 degrees towards inwards because I've had to compensate the way I walk. Now look at the spacing at the knee. Now, if you see on the right side, the normal knee has normal spacing, good fluid, good motion, good range of motion, and floatability. But you get over on the left-hand side, that's just actually, as a matter of fact, my doctors walked in one time about a year ago after having these x-rays, and he said, I expected to see your knee completely fused together. I don't understand or know how you're walking. It's very interesting. So that's a little bit about hemophilia and how it affects me. Now, there's a lot of things I'm going to talk about today as I dive into this. I grew up in rural Appalachia. I grew up in the heart of mountains, right on the border of Virginia. I was about 5 miles from the Virginia border. So if you're looking at Kentucky on the map, Kentucky and Virginia, I was right there in that neck of the woods. And so growing up in rural Appalachia, you know, there's a form of a lack of education. There's not a lot of information about bleeding disorders, preferably hemophilia. And so I grew up kind of wanting to be a normal kid and understanding very quickly I could not be a normal kid. And I will show you very transparently here, and this is, you're only going to see this here. I want to show you what happens. And so I wanted to play ball. I wanted to go outside and be a rambunctious little child, but I couldn't. My body wouldn't allow me. So here's my elbow. All right. So as you can see, I've got muscle wasting through here, and I can only move my arm. This is all I can move it inwards, and that's all I can move it outwards. That's what hemophilia does. This is a fused elbow. This is the right elbow that I was showing you in the x-ray. And you can see all the calloused damage that's done with the joint and the muscle wasting behind it. So growing up in rural Appalachia, there wasn't a lot of education, and I kind of wish there was. I wish I woulda, coulda, shoulda, you know, but it's one of those things. I was also a resident of the Ronald McDonald House. Now, one of the things you may have saw in the video, if you were here earlier, around age 2 or 3, now the very product that was supposed to help me, that I'm supposed to infuse here in just a few moments, the very product, this is hemophilia factor A concentrate. I want to inject this in just a few moments into my vein. But this product wasn't screened back in the 80s for viruses. And you already know where I'm going with this. So around 81, 82, this product was coming from a lot of crazy donation resources and reservoirs, and a lot of it was riddled with HIV and hepatitis C. Now, what does that mean for Joe? Well, around age 2 or 3, best as we can determine, I was co-infected. Co-infected means 2 viruses living within one host. I was co-infected with HIV and hepatitis C around age 2 or 3, the best we can determine. And one of the oldest living people in America, I know there's only a handful of like maybe 150 or 200 of us that are in the 36-year plus range of HIV positive. So I'm going on almost 40 years HIV positive. That's impressive. But so when you think about growing up in Appalachia and growing up with that mindset, there were so many things. The real heroes of the story is actually my mom and dad. My mom and dad took a lot of time and patience with me to get me to those doctor's appointments that I had to go to and get the lab work and get the infusions and the long extended stays. And I was a resident. I'm very proud of this. I'm a resident and a product of the Ronald McDonald House charities across America. My family and I stayed many times at the Ronald McDonald House as I had to do my week-long infusions and a lot of regimens and stuff, because growing up at age probably 5 or 6, your whole body, let's watch Joe inject and turn into the Wolfman. You're funny. I like you, Donald. But so, I will be honest with you, and this is a part that I didn't share the last time, and this is it's hard for me to talk about. So it deals with the aspect of bullying. I'll get it out. I promise. I'll get it out. I'm just trying to dance around it, but I was bullied extensively in high school and elementary school. I had a very noticeable limp, as I do even today, because of my right knee is completely just jacked up. And so through the extensive bullying, there was a lot of nights I came home from school and I raced to my bedroom and put my head in the pillow, and I would cry myself to sleep pretty much, because I didn't understand, why did I have to be different? Why can't I play ball like everybody else? Why can't I do this? And as you're a child growing up, you don't understand, and I didn't understand. And why was I the one singled out in the classroom? And so I would be the one that was in the back of the classroom with a sketch pad drawing away Spider-Man or Wolverine or Incredible Hulk or something like that, because there was no other way I could escape. I was called Bruise, Peg Leg, Cripple, Hop Along, Bruise. Yeah, Bruise was a hard one because I had a lot of bruises all over my body, which sucked tremendously. But, there was long extended stays too in the hospital during this entire time. I spent half of my life at University of Kentucky Medical Plaza in Lexington, Kentucky. And when I say half of my life, I literally half of my life in a hospital room, hooked up to an IV infusion because of HIV and hepatitis C, not because of hemophilia directly. And the doctors, when the doctors told my mom and dad the story in the news about the severity of my situation, they said, well, Mr. and Mrs. Burke, and this is my mom and dad conveying the story back to me, he's not going to live past age 16. Yeah. That's kind of hard to talk about. But so thinking that the fact that I'm getting ready to turn 39 in just a few days here, in 16 days on November the 30th, 39 years versus 16 expected, I'll take those odds any day. But, it just shows you that, the human spirit and the human strive to be able to just thrive in everything that we do. The human spirit prevails any prediction that a doctor can ever give you, and you are not defined by your illness. All right. So, moving along with long extended hospital stays, fast forward to 2014. Okay. So between childhood, adolescence, teenage, high school, bullying, long stays in the hospital, trying to figure things out. I was a lab rat, a guinea pig. And then in 2014, the miracle happened. And that was a drug called Sovaldi. Sovaldi was a breakthrough drug to treat hepatitis C, which is a virus that attacks your liver. Hepatitis C is inflammation of the liver. It's a particular type of virus that just works over time, a long extended time. Hepatitis A and B is more of a quicker acting virus on the liver. C, on the other hand, they call it the silent sleeping dragon. You can literally live 30, 35 years and never know you have hepatitis C. And then one day you start feeling weird and you go to the doctor and your liver counts are sky high and you find out, yeah, you have liver cancer or end-stage liver disease. It's very true. I've seen it happen many times. And so hepatitis C is called the silent killer. And so in 2014, in January, I started a 6-month regimen called Sovaldi. And Sovaldi ended up curing me of hepatitis C once and for all. So I got rid of one of the viruses, but I still have to live every day with one of the other viruses. And, when I was, let's go back to 1996, when I was taking HIV medication, I was taking 38 pills a day. That is like literally 12 in the morning, 12 in the afternoon, and 12 at night. It's a lot of medication, a lot of side effects, a lot of grueling. I had hives, rashes, kidney stones, you name it, I had it, because they didn't know what drug to treat. And I was the lab rat. I was the young lab rat that they used to try to, well, let's see if this works, or let's see if that works, or let's try them on steroids, or let's do that. Well, needless to say, due to modern science and how well we have progressed today, those 38 pills a day have now come down to just this. One single tablet called Triumec. Triumec is a drug. It's a specific kind of drug. And it's got 3 tablets in one. As you see, it's got a 600 milligram, a 50 milligram, and a 300 milligram. So it's 3 in 1, long acting. So I've went from 38 to 1 a day. Pretty awesome. Also, too, I wanted to share a quick thing. hemophilia medicine is chaos on the insurance companies. It's one of the, I think the top one, it's in the top 5 most expensive drugs in the world to treat. So if you have hemophilia, you already are sharing a lot of the burden. Now I'm going to share something with you too. And I know I'm moving along. There's a lot of information I'm trying to share here. This is a bill that I just recently got that shows you exactly how much the factor 8 is. It's $43,000. If you see there's $43,000 on there twice. The other expenses are for medical supplies and HIV medication, but 43 grand a month. Just let that sink in for a little bit. All right. Oh my gosh. So I'm going to go ahead and do the live infusion. So I've covered I was born a hemophiliac, co-infected with HIV, hepatitis C, got cured of Hep C in 2014. Today, I take a pill a day for HIV. I'm currently undetected. My CD4 count is very high. It's in the 450s, which is normal. And I'm doing very well. I actually got some amazing lab work back a couple of months ago, and it's honestly some of the best lab work I've had since I was a child. And so I'm just doing everything right, being proactive, eating healthy, being active, and doing as much as I can and not just kind of being stagnant. And that's the main thing, is just getting up and moving. So I'm going to move the camera around here, and we are actually going to start an infusion. And so this is the disclaimer part. So if you're a little, oh God, Joe, what are you doing? So I'm going to bring up cam number 2. Boom, look at that. And I'm going to actually turn the camera down to here. All right, so we got our camera. Let me get our things here set, and let me move the keyboard, and we will get this thing underway. So for an infusion, all you really need is just a couple of small little things here. I have a special tourniquet. This is a fabric tourniquet. As a hemophiliac, our skin is very, very soft, and we bruise very easy. So this is a fabric elastic tourniquet, which is kind of cool. The stream I just see is black. You might want to refresh, CK. And so here we have a tourniquet. We have a syringe, butterfly needle, one 1x1 gauze, one Band-Aid, and one alcohol swab. And of course, here is my factor 8 protein. And so this is the protein that I inject into myself. And so this is how we're going to mix it up. And here we go. And we're off. All right. This goes really quick because I've kind of done this. I'll tell you a quick story as I'm doing this. I was trained to do this at age 8. There's a hemophilia camp, a boot camp that you go to, and they train you how to infuse yourself at an early age so you don't have to rely on your mom and dad. To show you, this is a cool little device. It's a transfer device. Your saline's at the top, and the actual factor 8 powder is at the bottom. Can you see the powder there? The white stuff? So I'm going to actually pop it. So you just put your one hand on, and that's it. And it transfers the saline to the bottom, and it's already mixed to go. Now I'm going to extract that using a syringe. This is a regular 10 ml syringe. And then after this, I'm going to open up the seats, and I'm going to allow you guys to come in here and ask me some questions and stuff like that. But, hemophilia comes with its many challenges. It comes with a lot of hurdles and a lot of things to try to figure out. But you got to make the most of it. You just can't live your life, you just can't let it define you. You have to break free of whatever's holding you back. And, very early on in my age, I was in a mentality as I'm not going to let this define me. I'm not going to be the cripple in the back of the room. And even though I walk with the limp and I have bad joints and my body's all messed up, I mean, I'm not going to let that be, the one thing that everybody associates with. All right, so there's number 1. I've got number 1 in, and there's the 5 mLs there. I'm going to do the other syringe. Now, this factor concentrate is based on your weight. So I'm currently right at around 168, 170 is my body weight. So there's a formula that they use to actually figure out how many units of factor 8 that you need. So I'm going to be infusing 4,000, right around 3,800. So this is 1885, and this one is 1978, which is the number on that. So that's roughly around 3,800 units of factor 8. And it's based on the fact that I'm 170 pounds. All right, so I'll get this drawn up, and then we'll get the needle on, and we'll get this underway. But so many advancements are happening right now, even in the way of hemophilia. Out on the market on October the 4th that was FDA approved, and it's called Hemlibra, and that's Hemlibra. You can actually Google it. You can find a lot of FDA documentation about it, as it was just approved. But Hemlibra is a subcutaneous injection. Now, that means under the skin. Intravenous means in the vein. It's the first product in hemophilia history to not have to have a vein puncture for a treatment. Pretty cool, right? And so I do this 2 to 3 times a week. And on the new drugs coming out, it will be either once every 2 weeks or once a month. It's long-acting, long-lasting. And honestly, if I don't have to puncture my body as much to treat, then I'm pretty happy about that. All right. So, and also for hemophilia, there's also going to be some really cool genetic therapies coming out in the future. That is going to be pretty rad as well. They're working on some genetic stuff. It's using CRISPR. CRISPR is inserting a dead virus into your body and allowing a genetic makeup in your body to form an antibody to that actual chromosome or that DNA, whatever. And so the talk is within the next 5 years, they're going to have a genetic infusion, a once-in-a-lifetime infusion that will actually turn on the trigger in your liver to produce factor VIII. And so some pretty cool advancements as I'm talking here and going down the pipeline for hemophilia. And I'm going to put the tourniquet on. So, all right. So here we go. So I got the tourniquet on. You can see the tourniquet right there. And gauze and alcohol wipe. I'm going to go right here. X marks the spot. And I have to do this 2 to 3 times a week to keep my clotting levels and factor levels up. And immediately after I do this, I'm going to invite you awesome people on here on the camera with me, and we're going to do some Q&A sessions about hemophilia, HIV, and hepatitis C. Now, one thing I haven't talked about is going to be the chronic pain aspect, and I'm going to talk about that towards the end as well. But I do suffer a great deal with chronic pain as well. So here we go. You ready? All right. This is very quick, very easy, very simple. I want to take the needle, and I want to put it right in the vein. Now, if you're squeamish on needles, I'm so sorry. Look at that. Nailed it. All right, now you're going to be saying, well, why is he sucking blood back out from his vein into the syringe? Well, I got to get rid of all the air that's in the tube. I just can't infuse my that would like stop and blow up my heart. All right, let me release the tourniquet, and we're ready to infuse. It's pretty cool how they've streamlined this. I mean, I can mix and infuse myself within 5 minutes. So if it's an emergency, I can do it pretty quick. Now, used to back in the 80s, you had to manually mix each bottle. And that means you had to roll it between your hands and mix the powder. They didn't have the fast acting powder, stuff like that, like they did today. As you saw when I mixed the saline and the powder earlier, it was diluted. It was instantaneously diluted. Back in the 80s, that wasn't the case. So mom and dad would have to roll the bottles back and forth in their hands, and it would take 10 to 15 minutes just to make one infusion. Almost done. As you can tell, I'm getting down to the last 2 mLs here, and I don't feel anything. I don't feel any change in my body. I don't feel any kind of I don't feel any side effects from this medication whatsoever. I just feel, I guess, peace of mind, knowing that I can continue out with my day. I've got coverage in my body, which is kind of cool. So as I'm going down, I'm following the last little drop here down to the end of the needle, and then I'm going to pull it out, and we are done. All right, that's it. And get my gauze. And in one swell floop, I'm going to actually pull the needle out, hold the tourniquet down, and boom. Look at that. Nice. All right, so I'm going to put my Band-Aid on. I have a Sharpie container here right beside my desk, so if you heard that loud flip, that's what that was. All right. And one-handedly, ladies and gentlemen, I have just gave myself a factor 8 infusion. I'm good to go till Saturday on that. So let me flip the camera back up. Hi, what's up, everybody? I'm going to actually open up the seats here, and if you guys have a question or is there something that you want to ask or whatever, now will be the time to do so, okay? I know I've been talking like crazy. I've been talking like nonstop for 30 minutes. So I'm ready to answer some questions from you guys. And before I do that, I do want to tell you there is a great deal of chronic pain that I have to go through on a daily basis. For me now, as an aging hemophiliac, the biggest hurdle I have to face is not HIV. It's none of that. It's actually the damage that's done to my body already from living with hemophilia. That is the biggest hurdle I have to face today. And the doctors are very eager to prescribe opioids. They're very eager to, that's why they're talking about the opioid crisis. Luckily for me, here in Florida, we just recently got past the Florida medical cannabis law. So I do 10 drops of THC CBD oil a day. So I don't have to take opioids as much. I do still have to take Percocet from time to time because it's just the pain gets too much. But this has been really one of the best things that I do. And if you're in a state where this is not available yet, just hold on, it's coming. But this has really allowed me to do a lot more. And just as a matter of fact, just to kind of give you an example, despite my knees and my ankles and my elbows and my hips, my wife and I are annual pass holders at Walt Disney World, about 15 miles that way. I live in Orlando, Florida. So I'm able to walk long distances on new treatments. And I'm just so thankful that the politicians and everybody on board here in the state of Florida has come on board to allow these kind of products available to us. That is truly awesome. So I'm going to open up the seats here, and you guys can hop in if you want and ask some cool questions. We got John Preto coming in the room here. What's up, buddy?
Hey, man. The progression of the HIV drugs from 30X, I didn't hear the exact number, down to a triple tablet.
Yes.
What exactly do those 3 pills do?
All right. So you may have heard the term. That's a really awesome question too, by the way, that asked it. Have you ever heard of the term a cocktail? Well, he's on the cocktail medicine.
Yeah.
All right. So it's 3 different pills that form a protective shield around your T1 cells. Your T1 cells are your cells that fight cancer. They fight infection. They fight everything. And that's your immune system that's housed in the bone marrow of your body. All right. So these ingredients in this, they all form a kind of a layer. So one pill will block this area. One pill will block this area. So the HIV virus can't penetrate the T1 cell. And so as long as you take this and you have the levels of this in there, the HIV virus will not progress into AIDS, and you will not have to worry about it because you have the protection. Now, if I was to start taking, here's the harsh reality, John, if I was to stop taking this, in about 30 days, my virus would relapse. I would start showing counts in the thousands. Within a year, it would be counts in the millions, and probably a year and a half, I would probably have full-blown AIDS. That's the harsh reality. So this is the protective barrier around my T1 cells and around all of the immunity cells that I need.
And how long have you been on the single pill?
I started the single pill, I guess it was around December 2016 was when it just came on the market, and it was one of the pills that I started. But before that, I was on 6 pills a day. So just as recently as 2 years ago, I was still on a hefty amount of medication. Even when we were on another network together, I was still taking a lot of medication at the time. So science has come so far to be able to refine it in a longer acting, longer lasting medication that's released over time. So pretty awesome stuff, I think.
Well, you're a wonderful human being. We're glad you're still here to enjoy and entertain us.
I appreciate that, dude. I love you, man. You're
love
awesome,
you, brother.
dude.
We'll see you.
All right. Got Gisela coming in here. What's up, my dear? How are you? How are things in the beautiful city of Boulder, Colorado? I think Gisela is coming in. Maybe. Hello.
Hey,
what's up, my dear? How are you?
How are you, Joseph? You're so inspirational. I just wanted to thank you again for doing this. And Oh, by the way, I have a
Okay.
black eye.
It's okay.
Don't notice that. I just had a little bike accident. Anyway, I was actually going to ask you about some of the kind of upcoming treatments that are coming to market and where they are, like that genetic infusion that you were speaking of, that basically is going to be a one-time shot that, I don't know, sort of fixes your liver, it sounds like. Sounds amazing. Do you have a direct hotline to that?
Well,
like, when is that coming to market?
To answer your question, that's a really awesome question, Gisela, and thank you for asking the hard one. It's in the market. It's actually in, I think, phase 2 trials in the United Kingdom right now. Projected amount for the shot is $1.8 million. All right, now you say that, but if to treat a hemophiliac annually is around $680,000. That for 1 year,
right? So
you see what I'm saying? To treat one time with the infusion would make a lot of sense because the insurance companies would save a lot of money. So it's a win-win situation. The same thing happened for me in Sovaldi, the cure for hepatitis C. But to answer your question, it's an infusion into the liver, and they're inserting, it's called CRISPR. You can find it. It's CRISPR, I think. But they're inserting a dead virus into the liver, which tricks your liver into producing an antibody, which makes your liver switch on and start producing factor VIII protein. It's kind of cool what they're doing. But they're targeting bleeding disorder community as one of the first tools to use CRISPR because it's more easily administered into the bloodstream through the liver. And so if the hemophilia community and the bleeding disorder community reaps the benefit of this breakthrough science, then we're actually in about 4 or 5 years pretty darn lucky that we're going to be having this medication available to us.
That's so exciting. Well, I'm so happy to hear that there's something on the horizon.
Well, even for HIV as well, there's a lot of amazing things that they're doing with HIV as well. So I'm predicting within 4 to 5 years there'll be a cure for that as well. It's everything's pointing towards that direction. Yeah.
That's awesome. Okay, cool. Well, I'll just step aside. Right. Anyone else?
Thank you, Gisela.
Thanks,
appreciate it.
Talk
Take
later.
care, sweetheart. Bye-bye.
Bye.
All right. Anybody else want to hop in and ask a question? I have about another 10 minutes here. If you guys want to hop in and ask the hard, difficult questions, I would love to get feedback from you guys. And thank you guys, first and foremost, for just joining me here today. This has truly been an honor for me to just sit here. I don't consider myself a miracle or all of that. I'm just blessed to be here with you guys on this day. And so I'm very happy about that. And so we got Leland coming in here. Leland's going to be asking
for a minute. I'll be right there. Just hold on a second. There I am.
What's going on? Look, oh, wow. Wow, that was
crazy.
All
kinds of weird stuff going on here. I just got done with the broadcast. Sorry, Joe.
That was a fancy transition there. You kind of rolling around.
I was doubled up there, wasn't here? I'll just slide across on the screen a little bit.
What's up, buddy?
Well, I was wanting to get here obviously earlier, and then I realized our broadcasts were at the same time today. So I apologize for showing up late. I understand, it's really difficult, I think, for anyone that's dealing with chronic pain to just come out and talk about it, because I suffer from a torn shoulder ligament. I suffer from a bone spur in my spine, which is impeding on my spinal column. It's causing all kinds of issues in my lower back as well. So I deal with constant pain every day, and I'm either pumping myself full of ibuprofen and vitamins and whatever I can. I do take muscle relaxers on occasion. I stay completely away from opiates. So tell me a little bit about what and I know you probably covered some of this, but as far as your pain tolerance and your ability to control the pain, what's the regimen you kind of try to follow to make sure that you don't fall into that, okay, suddenly I'm back in pain again? Can you give us an idea of how you stay away from that?
To be quite frank with you, Leland, I've tried several options for CBD, THC oils and vapes and stuff like that. Mm-hmm. And in terms of opioids as well, I mean, I have a hefty stock of that on supply because the doctors are just so eager to write the scripts. But there is nothing out there currently in the world that relieves it 100%.
No.
For me, because when you have bone on bone grinding and the nerve endings in your bones, there's a lot. Nothing I've found in my years of research to remedy that.
Okay.
So what I do actually, though, is I wake up in the morning and I do 10 drops of the CBD THC 1-to-1 ratio hybrid.
Mm-hmm.
I do that under the tongue every morning, and that gives me about a 6 to 8 hour buffer. At night, I lay down and I do 2 or 3 puffs of the indica, which is 9-pound hammer blend from my local one. Yep. And so I do that. And in between now, if I'm having an actual episode, a hemophilia related episode, I will sometimes have to throw in a Percocet in the middle of that, but that's not every single day. But that's how I treat it. And unluckily for me, I've not found anything that eradicates it, and I'm pain-free 100%. I don't think I've ever had a pain-free day in over 25 years, Lee.
Yeah, it's tough. And it's been about 20 years for me. It was 2000 when I separated my shoulder and tore the ligaments, and the burst was bursted, basically. Yeah. So there's not much left there to maintain. But I think it's the same with me. I've tried to stay away from the narcotics as much as possible. And I think that's something people are now realizing, that narcotics aren't the only way. But it's all about inflammation. If you can control the inflammation, you can control the pain. I'll leave it at that, and I'll let someone else speak. So I'm out of here, Joe. Thanks for doing what you're doing.
I appreciate it, Leland. Thank you so much. What's up, JS? What's up, Brett? Hey, JS was next, so hold on one second, Brett.
I asked a couple of questions in the chat thing there, but also mentioned I'm on Butrans patches. I don't know if you've looked into that.
Butrans patches.
Yeah, it's funny. You know, Sid, his father, is in charge of the chronic pain clinic at the Toronto University. And so I was talking about my pain with Sid this a couple of years ago, and he said to look into it. And I have really had a lot of efficacy with it. It is it's an opioid.
Okay.
But it acts.
And what was the name of it again?
Butrans. Butrans.
Okay.
So I'm using those. They're patches. You put them on once a week. And then I do use also CBD and THC for breakthrough pain, you know, like if I overdo it or whatever. I'm more, more effective than I was before. So yeah, it's definitely been very, very helpful. So it might be something to look into. I forget. I asked another question, but I can't remember what it is. It's in the chat. Let's see. Hang on a second.
Donald, the window is not locked, actually. I don't know if you need to refresh, but the seats are open.
What was my other thing?
What's up, Brett Strickler?
What's up, buddy? How you doing?
While you're thinking about that, JS, I'm going to let Brett Strickler.
Oh, my other question was, what happens if you miss an injection? Yeah.
Oh, that's a really good question, JS. If I miss an injection, that means after about 2 or 3 days, the trickling down effect of the product in my bloodstream, I will be at less than 1% clotting factor, which is my normal. That's my normal, less than 1%. And if I don't inject and get that back up to 20, 25%, if I get into a car wreck, it's most certainly going to be fatal. And that's the truth of it. That's the reality of it. So, Brett Strickler, what's up, my friend?
Hey, man. Just wanted to come.
What's going on?
And, just, it's nothing, not much, man. Just on my lunch break.
Sweet, dude. Well, I'm glad you're able to hang in. Did you have a question you wanted to ask right quick?
No, I just want to say hey for you and tell you that love you, man, and definitely always enjoy hearing your story.
I appreciate that, Brett. I love to see you, man. I haven't seen you in a while, dude. We got to hook up.
Absolutely, brother. But I'm gonna step down and we'll chat with you later, man.
You take care, Mr. Strickler.
You too, buddy.
All right. What's up, Donald? What's going on, my friend?
Hi, Joe. I was just wondering because you've been using all of these different CBDs and these mixtures of CBDs. Did you ever find that there were certain companies that you were buying from that maybe the potency or the actual mixture, the blendings were not working very well? Or did you know right away?
They're different companies have different blends and different ratios. I mean, and the one I'm on right now, it's a local Florida chain company here because all of Florida has their own companies that grow their own product. And but when I started out, I was not getting the ratios properly. It was a different company. I wasn't getting very informed as well. So right now, though, I'm on a regimen that is actually really I'm getting the most benefit, the most bang for my buck, actually, and I'm getting. I'm at a nice plateau, and I'm okay with that. I don't think any more than that right there, it would inhibit my ability to be creative and stuff like that. I do a lot of things during the day and a lot of one-on-one conversations with people. I do a lot of ministry work as well. So I just want to make sure that I'm not sitting in the room or counseling somebody. I'm like, what'd you say again? No, I'm just messing with you.
Yeah, you don't want to get all foggy and loopy.
Yeah, I can't do that, man. I can't do that. But that's a really cool question, man.
Another question that I had, have they done much, what do you call it, combined stem cell research for those particular issues? I was just kind of curious because I know that they do a lot of stem cell, therapies for all these different, things in other countries.
Well, yeah, there is stem cell research on hemophilia, it being a genetically passed down disorder. It would make a lot of sense for stem cell research to come into that as well. But honestly, I don't think the science is there 100% for bleeding disorders. Now, from what I'm gathering in the community, I'm involved in multiple hemophilia bleeding disorder communities. A lot of focus right now is on this new CRISPR injection into the liver that I was talking about a little bit earlier. Yeah. And so that is kind of where they're seeing the fruit. That's where they're seeing the positivity and signs of things actually happening, where patients are literally handing in their hemophilia product that I just injected. It's like, I don't need it anymore. I've got normal clotting factor now. And that's where we're going in the next 3 or 4 years. And if everything falls into place, hopefully I can have a full documentation of that process and that journey in the beginning, for that as well. So I'm excited, dude. I'm really excited for the future.
One last question.
Sure.
This is a really tough one. Just kidding. No, I was going to ask you, as far as the pain management and stuff like that though goes, have you, because of the hemophilia, you probably don't have capability of drinking any kind of alcoholic beverages, do you?
That's a really good question, man. Yeah, this is why I love the Q&As. I do drink alcohol. I'm not opposed to it, but it's all in moderation. I think that's the key thing is, not being plastered, but enjoying it at the same time. I love a good glass of Cabernet and I love a good cold craft beer. And so as long as I have those in moderation, I'm good to go. It's not going to affect me either way. It's not going to affect the levels of the medication in my system. Usually rule of thumb is I take my HIV medication, which is the pill I showed you earlier. I take this around 12 noon Eastern, and my alarm goes off every day on my phone. I give myself about a 5.5 hour buffer after that, going into dinner time before I actually will have an alcoholic drink. So, but it goes back to moderation. And every patient is going to be different because some patients may have more liver damage than I do. And so, it's all about it. It's all about a case-to-case basis for sure.
And then one other thing too, what about your diet? I mean, have you ever, are you vegan? Are you meat eater, diet, dairy, all that stuff comes into play?
I am a T-Rex, bro, all the way. I love me some good meat. I love a good brisket. I love Wagyu beef. I love everything in that neck of the woods. But then again, it all goes back to one thing in moderation. So one thing that my wife is a registered nurse. And so she, many times she will help me with my infusions and she'll help me around the house when I need it. But one thing that we both agree on as a couple and as a married couple is that, it's portion control. We can enjoy the things we want to enjoy, but not like cleaning the plate. So we allow ourselves one time a week for splurge night, but throughout the week we have portion control meals. And that helps maintain my weight. That helps maintain overall my metabolism and everything like that. And, the old adage is junk in, junk out. So if I'm sitting here and I'm eating a lot of crap at night and shoving like half a gallon of ice cream down my gullet, that's not going to do good for anything. I'm going to get obese. Then what's going to happen to my joints and my knees and the x-rays that you saw? That's going to be even more complicated and painful. So I have to watch my weight. I keep my weight between 165 and 170. And if I start getting over that threshold, I immediately start tapering down and I get back down to where I need to be. But I'm always hovering. For the past 12 years, I've been in, I'd say for the past 4 or 5 years, I've been 165, 170.
Oh, that's great.
But in moderation, portion control, to answer your question.
Cool.
So
good way to be.
Yes, sir.
I'll talk to you later, Joe.
You take care, mister. Thank you, sir. Anybody else want to hop in? I'm getting ready to close up the broadcast for today, but I do have time for one more question if somebody wants to hop in here.
Joseph Burke, you know that
Stacy Bryuka.
You know how I feel about the struggles you've been through, and you know, just inspirational. How you've dealt with that from a very young age, and the things that inspiration has turned into. Your creativity stemmed literally from the fact that you were in those Ronald McDonald houses and in the hospital all the time, and I know that part of the story.
Yeah.
But the part that I'm curious about today is, I put it in the chat actually, was what would you say to, and this comes from my professional background. I'm a clinical social worker / therapist, and then I'm also a public health educator and researcher.
All right.
So if you were to come across one of my colleagues out in the world, what would you say that is just like the first thing that a therapist might want to know about either where you were as a child, somewhere in that journey, or where you're at now? I know it's a big old question.
It is a big question. I'm trying to process
kind of the same thing about what would you say to a public health educator?
What would I say to a public health educator? Now, in terms of what? What is the question?
What would you say is one of the most important them to do when they're working with so a public health educator, when they're educating the rest of the world about why hemophilia is a challenging disease, or maybe if they're maybe a social worker, if they're advocating for policy for CBD oil.
Yeah.
For people with chronic pain.
I would think that, to really have your finger on the pulse of the community, specifically the HIV, hepatitis C, chronic pain, and hemophilia community, is just knowing that you are not defined by your disease. You're not defined by your illness. And so many times, in some of the talks that I do here in Florida at the Hemophilia Foundation, is I see a lot of kids come up and they wear that shroud of I'm a hemophiliac around them, and there's a certain cloud over their head, and they're not walking boldly and confidently because they're just not there yet. And so empowering,
like Linus in the Peanuts,
kind of,
or not Linus,
but I think it's just empowering them to be able to know beyond the shadow of a doubt that, and it's just coming alongside them and educating them. And that's the biggest thing is understanding truly the boundaries and the aspects of your illness and of your disease. And when knowledge is power, when you begin diving and doing your own research and understanding what it is that you actually have, there's a sense of confidence and boldness that happens. There's a spark inside of you that kind of starts welling up. And I think that's when you can start understanding that, you know what, I'm not going to let this thing define me. I'm not going to let X, Y, or Z be what everybody knows me for. Oh, there's Joe, the hemophiliac who got HIV. Instead of, oh, there's Joe, he likes to draw and he does a lot of other stuff as well. Mm-hmm. So going out into people and practitioners and pharmaceuticals and pharmacists and stuff like that, I would just say empowering them with knowledge. And a lot of times if you go to a hospital, a local rural hospital that's not an actual university or, something like that, where they have interns and stuff like that come in and do all the research and development, you go to a mom and pop hospital, it's the only way I know to describe it. They're not going to know what hemophilia is or how to treat it. But you go to a major university where they're having, fellows and science and medical doctors and training and stuff, they're going to know what hemophilia is. And so I think it goes back to education, being able to educate everyone, bringing them up to speed on exactly what it is, and then kind of walking boldly and confidently in knowing that, hey, this is not the end all be all. This is not what Joe Burke is going to be defined as.
And I think actually what I just heard you say besides that is besides the education, or what part of what the education does is you're joining them in their journey and empowering them with the education so that then they can be courageous to accept the confidence to be themselves, not to be what the disease defines them as.
So many people I see specifically, they are defined by that one thing. And I was like, oh, well, I've got this. And it's just, and that's one of the first things that comes out. Hey, how you doing? What's going on? Well, my whatever so-and-so is acting up today. And I'm just like, man, that's and it's understanding.
So that is our socialization.
It is our socialization, but it's also reworking how we think. That way we can have a more positive outlook on the future.
Pathological, we look at things as problems as opposed to how do we prevent them or how do we work with them or within them.
Right.
Thanks for answering my question. I appreciate you. And I hope that there are students of mine, maybe I've put it out everywhere. I hope they come and watch this because you gave some great information.
Thank you. I really appreciate that. And I got the last question of the day going over to Lindsay Badger.
Yeah, I got the last question. It's a good question. I typed it over in the chat, but I am going to reiterate it. What would you say to your 8-year-old self now, today? If you were able to go back to your 8-year-old self, where were you when you were 8-year-old? Where were you?
I was in elementary school. Probably 2nd grade or something like that.
I remember you said that's when you first started doing your own infusions, correct?
Yeah, around 7 or 8 years old. Yeah.
Let's go back to that time. What would you say as an adult, approaching 40, not quite there yet?
All right. So if I had Doc Brown's DeLorean and we could be in the Back to the Future and go back to 1985, I would actually probably I would show myself what I look like today with the joints and the damage and be like, because you want to do this, this is what you're going to have in the future. Don't do it. Take the back seat, be in the back of the class, keep on drawing. Don't try to be like all the other jocks and try to fit in. Be yourself, because if you do, you're going to get injured, and injury over injury over injury is going to end up causing you to have suffering and pain in the future. So that would be what I would tell my future self is like, and
that's incredible.
Again, it goes back to what I said at the front of the show. It goes back to just, being educated and knowing about your disease, about your illness and your limitations. So, yeah.
And I know that you had discussed possibly doing a part 2 or follow up to this with your.
Yeah. I want to discuss it. Don't you roll into me. Don't you roll into me.
I was just going to give you a little segue and I'm going to hop out. So I'm going to let you close up the show.
Nice. So I'm going to wrap things up here. You take care, Lindsay Badger. All right. So I'm going to close the seat, guys. I'm going to wrap things up here, but I do want to say, I want to thank everybody so much for just showing up today. And hang around at the end of the show. I'm going to open up the seat and we're going to have some more discussion as soon as I hit the stop button on the broadcast. But, I want to encourage you guys to do something for me. If you want to do something proactively for Joe, come over here on Get Vocal. Create an account on getvocal.com. That's GETVOKL.com. And share your story. Share something. It doesn't have to be a personal story, but just share something. Be creative. And, by sharing and being transparent, your story is going to help so many people in their walks of life. You can't even fathom the trickle effect that's going to happen in other people's lives, because chances are other people are going to be able to connect with you because your willingness to be transparent and to open up and to share your story. And so you guys can find me over on social media. I have everything in the world at istrive2thrive.com. That's ISTRIVE2thrive.com. And I'm also at istrive2thrive on Twitter, Instagram, and Facebook as well. So you can definitely find me over there. I want to pause for a second and give thanks to some awesome people. I want to thank Stacy Bryuka with Go Create with Stacy, who was just in here in the room with me. Stacy, I love you very much. And Lindsay Badger, who was the last on the camera here. These two people exclusively, they spur me on, and they are my cheerleading. They're my crowd. They're my family. They're my sisters. And I love them very dearly. I want to thank Cliff Bodenweiser for his continued ongoing love and support always. Cliff, I love you. John Preto, I love you, dude. I just love your approach to life, and I just really admire and look up to you. And Leland Best, dude, I thank you so much for inviting me to this platform, and Bobby Shadow as well. I love you guys for your love and support. Remember that you are not defined by your illness. If there's one thing that you can take away from today's lesson and educational stream, is that you can't be defined and you can't be put into a box and let others define you. You are not defined by what it is that's ailing you, because you're so much greater than that. And illness isn't a burden if you think about it from the different perspective. And your trials do not own you. Your trials define you. And I know my life is being refined constantly through trials and circumstances. And honestly, it's all for the better. And I'm very thankful that we have a platform like Get Vocal where we can get on here and we can share our story. So I encourage you guys, go out, share your story, be creative, and strive to thrive. Thank you guys so much for joining me. And I want to leave you with one awesome graphic as I hit up the close button for the night. This is an individual who has inspired me to create, to know that I'm not the underdog, that I am the superhero. Somebody I looked up to and somebody that we all look up to. Thank you.